What's up, Joanna? Alright, I figured I would go through my note cards and find you my top pick note cards that are like, you know what I mean, just naturally stuff we forget. So we talked about the preeclampsia. We have 3 treatments, right? So if it's real preeclampsia, then the patient never had hypertension before. So the vignette's gonna say, history is, you know what I mean, shows healthy patient, whatever, whatever. They won't mention anything about hypertension in the past. If they did have hypertension in the past and they're pregnant, and you just want to treat them for their hypertension, give them methyl dopa. But know that if they say anything about a positive Combs test or that they're on TCAs, know when and when not to use methyl dopa. And then for preeclampsia, the treatment of choice is do nothing. Second one is going to be deliver the baby and not before 32 weeks because they can get neonatal acute respiratory distress. And the third treatment choice is, so if they're under 32 weeks, or they don't want to deliver the baby early, then you're going to pick between hydralazine and labetalol, whatever. And the way you pick between these two is you look to see their history. So if the patient is like an elderly, you don't want to give them hydralazine, or if he's got lupus, I should have probably put that in there. Don't give them hydralazine because it can cause orthostatic hypertension. Or if they say they want a drug that acts on the arterioles, then you could say hydralazine. The other one is labetalol, and don't give this to asthmatics, people with heart or diabetes. So as far as UWorld goes, these are just my notes off UWorld, but I have magnesium sulfate for eclampsia, and that's for treating and preventing. So I'm sure you can still use magnesium sulfate for preeclampsia too. I'm going to double check and look it up. All right, peace.